I'm Raul Harris-Collazo, Head of Medical Affairs at Santaris, a specialty biopharmaceutical company located in San Diego, California. I'm joined today by Dr. Ken Fujioka, who's an endocrinologist and director of the Nutrition and Metabolic Research Center and member of the Division of Endocrinology and Diabetes at the Scripps Clinic Del Mar in San Diego. Today we're going to be talking about obesity being classified as a disease by the American Medical Association recently. Ken, thanks so much for joining us.
Pleasure to be here.
So the AMA just recently came out with a statement suggesting that obesity is a disease. So can you elaborate a little bit on what your feelings are on that?
This is a big deal because obesity as a disease changes everything. So first off, it was pretty straightforward. You have a genetic component, you have comorbid problems, classic signs and symptoms. So it was probably pretty easy for the AMA to say, hey, look, it's a disease. But the fact that you're recognizing it is really going to turn the field around.
Wow. So you do mention signs and symptoms. So what are some of the signs and symptoms that would cause the AMA to think this is a disease, not just a syndrome?
There's probably well over 10 different diseases clearly associated with obesity. Everything from diabetes, heart disease, strokes, but even certain cancers. So all these, when you look at them in total, this is a big reason why this obesity disease costs so much to the American society.
So Ken, with all of these health problems associated with obesity, how does this affect the quality of life of the patient?
It obviously affects it in a lot of different ways, but if you just look at mortality, somebody who's obese, in other words 40, 50 pounds overweight, their lifespan is shortened by 6 years. So in other words, if somebody's overweight or obese, 40, 50 pounds, we know that they're going to live 6 years less. If they're seriously obese, then all of a sudden it's 10 years or more less that they live. But that's only half the story. The other half is that when you look at somebody who is overweight, the last 10 years of life are not disease-free. They have other medical problems, diabetes, heart problems. They may have to have a foot amputated because of the diabetes or related to their weight, all kinds of other medical problems. And this is where the U.S. is clearly falling behind relative to other countries.
The CDC reports that 70 million patients are obese. And so by the AMA classifying obesity as a disease, are we now putting undue burden on our healthcare system or reliance on pharmacotherapy in order to treat obesity rather than just lifestyle?
That's a really good point because you're right. When you classify something as a disease, now doctors can actually bill for a visit for that and there might be supposedly more costs. It turns out we're already paying that cost. There's different ways of looking at it, but if you just look at the average, quote, obese patient, somebody who's 40 pounds, 50 pounds overweight, and you just associate the costs, on average they're going to cost $600 to $700 per year more. But it turns out if you look harder, one is we tend to underemphasize our weight, so if we really bias or turn that bias factor into reality, in other words, because there's clearly more overweight people than we think. But the other one is if you look at the diseases associated with obesity, then the costs go up dramatically. We're talking $2,000 to $2,500 a year more for the obese patient with significant medical problems, obviously being diabetes. So we're already paying for it right now in terms of really thousands of dollars per year for the overweight patient.